going to be talking about roundworms in multiple sclerosis, and not just any roundworm, but large roundworms. All right, I got a notification here. So, if we haven't met, my name is Pam Bartha, and I am the author of Become a Wellness Champion and the founder of Live Disease Free. And this is an important topic because in my recovery from multiple sclerosis, I had a lot of parasites, and the research is showing that parasites cause multiple sclerosis. And we've worked with hundreds and hundreds of students all over the world and helped them to recover from MS. And in their recovery, large roundworms are always part of the problem. And so today, what I'd like to do is I would like to discuss what they are and signs and symptoms of them and how we treat them. And I've got a special treat at the end for you. I'm going to share just a few of the hundreds of pictures of worms that I have collected from my students. And so, what I'd like you to do is just say hello and I just want to make sure that you guys can hear me because I did update the system and I just want to make sure that it's working. Let me just refresh this. Let's see. Yes, it's working. Awesome. So let me go back to here. All right. So today, again, what we're talking about is large roundworms. There are many different types of roundworms, but we're going to talk a little bit about what I believe are called the Ascaris roundworms. And they're really, really large. And sometimes it can be mistaken for, let's say, a tapeworm. So, with multiple sclerosis, what's really, I think, hindered are us moving forward in the experts really understanding that multiple sclerosis is an infectious disease caused by parasites. Is that there was some research published a few years ago where they said that they did a study and they gave MS patients worms, hookworms, and they felt that giving the MS patients these hookworms helped to modulate their immune system. So, with multiple sclerosis, the way that our standard of care views MS is that our immune system has gone awry. It's attacking our own tissue, our nerve tissue. And so, by bringing in these hookworms, by giving these poor MS patients hookworms, they felt that there was a possibility that it could help to settle down the immune system, modulate it a little bit, and not cure people, but maybe give them some symptom relief. And when I read that one of the articles years ago, um, at the very end, it said that a lot of the participants, they asked to have the parasites removed because they had so many gut issues from the parasites. And so that is something that makes a lot of sense to me. So hookworms are a little different than the worms that I'm going to be talking about today. The hookworms would definitely be, they're only about like 1 centimeter long. And the worms that I'm going to share with you, the pictures, will be anywhere from, like some of our students, 5 or 6 inches long, but sometimes at least 2 feet long. And so with hookworms, so with the research, they're saying, oh, well, these hookworms, they don't really cause any problems. But when you look at the symptoms that they do cause, that if you've had a lot of hookworms, they can cause anemia, they can cause protein deficiencies, and also the anemia causes blood loss because of where the parasites are attaching to the intestinal wall. Children that have a lot of hookworm infection, they could end up with retarded growth and decreased mental development. Other symptoms of the hookworm: itchy rash, cough, wheezy, trouble breathing, abdominal pain, weight loss, diarrhea, and loss of appetite. So those are not good symptoms to have, absolutely. And again, that was research. And, one of the leaders in the MS world, in the integrative MS world, she believes in that research, right? And so, unfortunately, like this is really hindering us moving forward when they're publishing information saying that parasites are actually good for us. And I 100% disagree with that. I mean, if you had certain worms, maybe you had bacterial infections in your gut, maybe some of the worms will eat some of the bad bacteria. But the problem is the worms cause all of their own problems. They cause all of the symptoms, as I mentioned, and more. So that study, there's one published in 2020, but I can't remember if there was more than one study. There are many other roundworms or nematodes, and we're going to focus on the larger ones, but just be aware as I'm talking that what we see in our students that have multiple sclerosis is that they don't just have one type of nematode, of roundworm. I've shared with you the intestinal flukes that we've seen very often, and I just got a fresh intestinal fluke picture this week from one of our students, and I'm going to add that to our fluke um, resource page, which it's a blog post on livediseasefree.com, and you'll see pictures there of flukes. And there are also other worms. So there's thread worms, and thread worms can cause all kinds of symptoms. They're smaller too: nausea, diarrhea, fever, blood in the stool, dry cough, coughing up blood, trouble breathing, itchy where where the worm enters the skin. And I forgot to mention too that with the hookworm, we get infected from them when we're walking barefoot on contaminated soil, and they actually can go through our feet, or we can ingest the larva also. And we'll talk a little bit more about that. So that would be threadworms. So we talked about hookworms, we talked about threadworms. They're small also. There's trichinosis, which also is another type of nematode. And these are all kind of like the roundworms. So there's roundworms and flatworms. Today we're talking about the roundworms, but I'm going to focus in a few minutes on the very large roundworm, which is called Ascaris. But please keep in mind that in our students, we do see smaller worms. We don't know what they are. We don't know if they're threadworms or if they're whipworms or if they're hookworms, etc. But the trichinosis can cause diarrhea, abdominal pain, fever, and muscle pain, sensitivity to light, headache, and pink eye. Whipworms can cause abdominal pain, diarrhea, and anemia. And on to today's topic, which is the Ascaris worm. So remember that in what I have shared with you is that the sicker we are, the more infested we are, and the more out of balance we are. So we don't just have like one type of worm. We can have multiple types of worms. We can have roundworms and we can have flatworms, the flukes or the tapeworms. We can have large roundworms and small, but the large roundworms, and I just want to create awareness about this because what we're seeing is that they're trying to say, when you look online with these parasites, it's like, oh, most people just don't have any symptoms, they don't even realize they have them. But I think that a lot of us, we just have a lot of gut issues and we don't realize that it's caused by these worms. So with the Ascaris worms, they can grow over a foot long. So they're going to be very large. Our students, they're anywhere between, some of them, like maybe they're developing and they could be less than a foot long, but we've seen them that are up to about 2 feet long, maybe just short or just over 2 feet long. It's quite shocking when people are passing them. They can be as thick as a pencil. The ones we've seen are not quite that thick, but they can be as thick as a pencil. So when you're looking, let's say you're deworming, you're treating yourself for parasites, and you're passing things that look like parasites, that's why I'm going to share the pictures with you. They're fairly graphic, so hopefully you can handle them. They're pretty clean, but they're still pretty graphic. But what's shocking is that people can have at least like up to 100 of these Ascaris roundworms inside of them that can infect them. You could be very, very sick when you have that many. And another thing to keep in mind with treating them, they're really challenging to treat because they can lay 200,000 eggs a day. 200,000 eggs a day. So symptoms. So again, a lot of the different sources online will say, oh, people really don't notice that they have any symptoms. But when we're really, really sick with chronic disease like multiple sclerosis, and then we're passing these worms, like our students notice really significant improvements with things like their cognitive function. They find that they have a much more clear head, their memory is better, they're sleeping better at night for sure. They they don't have as much nausea, like the stomach issues, the pain, the stomach pain is another one. And then when they're passing a lot of these bigger worms, they notice they have more strength. They they can walk better, they can walk straighter, they have better balance, spasms go away. And I'm not saying that the large roundworms are causing all of this, but it's decreasing the burden. And yes, when we're doing the oxidizing enemas, we are flushing out other parasites too. But it's pretty coincidental that every time we're flushing out these very large worms, we see like huge improvements, like very, very quickly. And before I forget, I just wanted to mention too that very often, and this is what I believe, is that these larger parasites and even small filarial worms, but it's been shown in science that they carry their own parasites. And so when the worms are being broken down or digested, like when they're killed inside of us, and if we're not passing them immediately, then our immune system is going to react to metabolites that maybe they produce when they're dying, or if they're releasing their own parasites. So that can cause an immune response too. That could cause us to have a little bit more, like stomach issues or headache, or we could feel that we're having like not cramps, not muscle cramps, but just like a little bit of twitching and like all kinds of different symptoms. So it's it's a complicated process, but like I'm hoping that the experience that we share with you will really help you in your journey recovering from chronic disease. That's why I'm doing this, is that I want you to know what you're looking for, because like a lot of students when they start, they're passing little pieces of fiber and it's like, is this a worm? And I'm like, no, that's a piece of lettuce or a piece of fiber. They're very, very distinct. And when you look at the fluke blog post that we did and the video, you can see they're very distinct, and the roundworms are very distinct also. So, in the lungs, these large roundworms can cause a persistent cough, shortness of breath, and wheezing. So, you wouldn't think that these large roundworms, they're not they're not adult form in our lungs, but it's the immature larva that would get into the lung. It's part of their life cycle. In the intestine, the the larva, what'll happen is that they'll settle in the intestine, they go up to the lung, they do their thing, they come back to the intestine, and they grow and they develop into an adult, and that's where they live in the small intestine, not the large intestine, in the small intestine. And so if you have mild or moderate ascariasis, which is the disease that's caused by these big fat roundworms, then you might have, and this is just if you have a little bit, so abdominal pain, nausea, vomiting, diarrhea, and bloody stools. And and then also if you have a large number of these worms, I already shared some of the symptoms, but in the literature they talk about severe abdominal pain, fatigue, vomiting, weight loss, or malnutrition, like you just having a hard time putting weight on, you lose weight way too easily. And sometimes you can see this white string in your stool or in your vomit, and brain fog and weakness. And so that, like some of these parasites, they can cause, and I've been doing some research, but these worms, they cause a certain type of white blood cell to become more populated because it helps to defend us against these worms, and that is called the eosinophils. And the eosinophils, they are also linked with allergies, asthma, and hay fever. So it's interesting that when these white blood cells are in higher amounts, they are responsible for helping to fight worms and parasites, and they're also linked with all kinds of allergic type reactions. And what we have noticed with our students, that let's say, some of them have MS, some of them have other diseases, maybe some just have chronic allergies where they have to live on antihistamines. When they treat the parasitic worms really well, and they could be treating other smaller parasites, but we definitely see the larger parasite worms coming out, their allergy symptoms really settle down tremendously to the point where they don't need antihistamines and they don't have asthma symptoms. And I would never test an anaphylactic type, um, something you're sensitive to where you would get an anaphylactic reaction. I would never test that. But for a lot of other things that people find just general, lower grade food sensitivities improve and go away, people can eat different foods. And so there's a really big connection between parasites and allergies and asthma and hay fever. And I've seen this in people that have MS, but also people that don't have MS, that just had, let's say, a lifetime of hay fever and allergies. And the parasites that come out of them are quite shocking, really, really shocking. So the larvae, they hatch from the eggs in the small intestine, and then they go through the intestinal wall and they travel to the heart or the lungs through the bloodstream or the lymphatic system. And after they mature in about 10 to 14 days in the lungs, then the larvae break into the airway and they travel up the throat, and then you cough them up and you swallow them, and then they go down to the large intestine, small intestine, and that's where they grow and they live there. And they live, so this is, I would say that the life cycles of the parasites, it's not an exact science. You'll see differing opinions on different sites of where they have this information, but in a general sense, they can infect the lungs, they can infect the heart. They live as an adult in the small intestine, and they can produce 200,000 eggs in a day, and which is absolutely horrible. As far as the treatments, there are, like, what we're looking for. So what our students do is they first get ready to treat. So they decrease the carbs. They follow the Live Disease-Free guidelines. And you can find those on, just do a Google search, Live Disease-Free Diet Guidelines. You'll find them on our website. And then they're decreasing the carbs especially, and they notice that they have a ton of symptom improvements. Then they're supporting the body. They're making sure that they're having daily bowel movements. They're sleeping really well every night. This is all part of the Live Disease-Free plan. And then once they are feeling a lot better, the parasites are less active, the worms are less active, then they will get energy tested to see which of the treatments test the best for them, because we don't have good stool tests. I mean, if your stool test is covered, you don't have to pay for it. Go ahead and try, but usually the parasites are not showing up on the stool test. And then they will find out which of the treatments are testing best for them. So there are several different types of parasite medications that will treat roundworms, and it really depends on what type of worms you have. Maybe you have pinworms too. Maybe you have threadworms or whipworms with your Ascaris worms. Like, you don't know until you're actually energy tested, and that's why I really don't recommend, like, people are like, well, I'm just going to try this one parasite drug and I'm just going to take it and see if it helps. The problem when you do that is that these parasites can become resistant to treatments. And then, are you even taking an effective dose? Like, if you're taking a suboptimal dose of something, then it's not going to do anything. And then you're just wasting time, wasting money, potentially making the parasites resistant. So you've got to work with somebody. You've got to work with a practitioner, or we support people in the Live Disease Free Academy, helping them access all the support they need. But you want to use the right treatments, you want to use effective doses, and you want to use it in a safe manner. So what I'm sharing with you is not to say this is what you need, because I don't know what you need, but these are just some things. If you did a Google search and you're like, how to treat Ascaris roundworms or whipworms, or any of these round nematodes, there is the drugs would be mebendazole. So that's one of them. And there is albendazole, and there is thiabendazole, and there is ivermectin. So there's quite a few. And I do know that more recently there has been fenbendazole, but I don't know how well that treats the roundworms. I think that from what I looked at, it was more helpful for Giardia, but it's definitely for parasites too. And now it's being used for humans. So there are a whole bunch of different parasites. So the roundworms are treated more by the albendazole and mebendazole and thiabendazole. There's also levomizole, which is not available in some countries. I'm trying to think if there's any others they're all part of like a certain family of drugs. And again, it really depends on the type of roundworms that you have. And also, if you have, let's say, these huge roundworms, but then you also have smaller roundworms, you want to treat both of them. You don't want to just treat one of them. And also, like, very often these worms will cause anemia. So then we definitely want to build up our iron so we become deficient in iron. And then sometimes pain relievers, anti inflammatories, antihistamines, anti- antibiotics. So with certain roundworms, they will release a terrible bacteria that causes really significant inflammation. And in that case, then the doctors are prescribing antibiotics with the roundworm medication so that it's killing the bacteria that causes a lot of inflammation. All right, do you guys want to see the pictures? Are you ready? Like, they're pretty disgusting, but it really helps you to understand what you're dealing with. All right, so I'm going to go first to the PowerPoint that I have for you. Hopefully everything works out all right here. And let's see. There we go. And I will make this larger. Okay, so you guys are ready because these are going to be very graphic, all right? So just so you're forewarned. All right. Okay, so large roundworms in multiple sclerosis. So the first picture is from one student, and I'm going to talk about an oxidizing enema, and I can't say what it is, but it's just an oxidizing enema. It's basically using water and bringing oxygen into the large intestine. So remember that a lot of these large roundworms are not present in the large intestine. And when we do an enema, we're only going to reach the large intestine. We can't reach the small intestine with enemas. There's a little valve between the large and the small intestine, so you're only going to be able to reach the large intestine with an enema. But with this student, like she did she's treating, like she did all the prep work in the Live Disease Free plan. So she's one of my students. And this was a few years ago. She followed, and I'm sure she had a diagnosis of MS. So she followed the prep phase and was feeling a lot better. She was energy tested. She was taking the treatments, got a prescription, was taking the treatments that tested well for her. And what I believe, and this is what I've seen in myself and other students, is that like the parasite drugs that we're using to treat roundworms, the ones that I mentioned, whichever ones test well for us, they're not a magic cure, especially for the very large parasites. They're very helpful. And yes, we do pass some of the roundworms just by taking the parasite drugs, but we have seen on many occasions that, like when we're taking the parasite drugs, it's almost like the roundworms, they sense the poison in the small intestine. They don't like it, so they're moving down the small intestine into the large intestine, and they're not quite dead yet. But then when we do the oxidizing enema, that's where it kind of finishes off the job and kills the worm, and then we pass it. So she did the oxidizing enema, and usually students will do it like one morning and then the next morning, or one night and the next night. It's not that you can't do it more often, it's just time, right? It's like if you're working or you're busy, it's like maybe mornings are better for you or nights are better for you, but usually when they're treating, they'll very often do one enema per day while they're treating. And so she did the enema, and normally when you do the enema, you feel amazing. Like you just like, oh my gosh, I feel like so good, like mental clarity, you just feel good. But then sometimes within an hour or so, you can start to notice maybe a little bit of gut pain. Maybe you're noticing that you might find that you just have a little bit of a headache, a little like a dull ache in your stomach, a little bit of foggy head, maybe you feel irritable. So it's nothing serious, but you just know you just don't feel as good as right after the enema. And if that's the case, then it's absolutely fine to do another enema. And so she did that. So then she flushed out this worm. So this worm was it has not died and been present in the body for a long period of time. So it's still fairly intact. It's not like when we kill the worms and if we don't pass them right away, our body starts to break them down, right? It wants to get rid of it, it starts to break it down. And this one is pretty intact, nice and clean and neat and tidy, right? The next ones are not quite so neat and tidy, but not bad. So the next student is somebody who was recovering from MS. So she's been recovered from MS for a few years now. And she passed a lot of these very large roundworms. It was shocking. Um, she passed multiple. So I've got two pictures of two different ones that she did, but there were quite a few. And again, when we like, it's not just that we're treating and we're getting them out, but I always ask the student, like, do you notice symptom improvements? And they're like, oh my gosh, like instantaneously when I passed it, like it's like your immune system is like, it's out. I don't have to fight it anymore. And so I think that there's this different reaction when the parasites die and our immune system is dealing with it versus when they're living. Because I know just as that study which was trying to say that these hookworms were so immune modulatory, well, I think that the worms have ways to cause our immune system not to deal with them like they should. So this was one parasite picture that roundworm, very large roundworm. And I always ask the students to put some kind of measuring device beside it so you can kind of get a sense. And also the tile you can see. So this one would be, I would say, around 2 feet long. This one would be a little bit shorter, but this was another roundworm that she passed, again, recovering from multiple sclerosis. And because it is long and skinny and pretty round, and when you look at them close up, you can tell if it's a tapeworm, it'll be like really flat, like a ribbon type. And the roundworms will be, and I'm going to show you a little video after where you can kind of see closer up a roundworm. So this is another student sharing, again, treating with, I know he started with herbs, the parasite herbs, antimicrobial herbs, and then he started to use the parasite drugs, and he was using the oxidizing enema also. And this, I don't know if, when I see it a little bit knobby like that, very often it is because it is being partially digested. So he might not have done the enema, like not kill the parasite and passed it immediately. He might have passed it within 24 hours or longer from doing the enema, but you can see that it's still quite intact, so it's still pretty fresh. And then this is from the same student. This one, it's a lot more fleshy. So you can tell a big difference between mucus. So you can see some mucus in the center of the picture, very different than the fleshy roundworm. Hopefully I'm not grossing you out too much, but I'm so used to this. I get all kinds of pictures from my students, like bowel movements and worms, and so this is another one. And I don't know if this is the complete worm. It almost looks like it, but this one looks quite fresh, like the ends. It almost looks like a large earthworm, right? And it's not as segmented like the earthworm would be, but it's round and fleshy, like almost like an earthworm. And then this is from another student. So this one would be a little bit more digested. And then there's a couple more pictures here. We're going to put these all up on our website blog, and that'll be the same as the title, Large Roundworms in MS. So this is another student. And so this one, when you add, like she bent it over in half, but when you add the two together, it's getting close to like 20 inches long, which is amazing. And then the next one, this is a different one again. Another, and I don't know if that other segment was a part that broke off or if it is part of it. And this one, you can see that some areas, like in the bottom right-hand corner, it's still more intact, but then you'll see that like mucus can be introduced around the worm, and you can see the immune system or the body just starting to break it down, digesting it a bit. So these last two pictures, I believe, would have been like once every 24 hours. So like in one enema, and then 24 hours later, the next enema. So the worm would have been dead and, being partially digested over the period of several hours. But these enemas are amazing. They definitely, And I've tested this myself too. Like when I first treated it 2 or 3 years ago, and I tested well for 5 parasite drugs, then let's just see. Oh, here's another one. This is the last one that I have for you. So I tested well for 5 parasite drugs, and I worked my way up working with my practitioner that prescribed. And eventually I was able to take all 5 together. And so like I would literally like take 5 parasite drugs together for 6 or 7 days, not doing any enemas because I wanted to see if, the parasite drugs on their own would be enough to get rid of all the worms. And then on the 7th day, I did enemas and would pass things like this. Like, and you can tell when they're more white. They're not really, really dark. They're still fairly fresh, even though the immune system is not the immune system, the body is starting to break them down a little bit. They're still quite fresh. They look kind of white. So what I'd like to do now is just show you a little short video, which is just a few seconds long, but it's a little close up, and it helps you to see like this is not mucus. Like, because some people are like, is that mucus? Like, is it just a string of mucus? Mucus falls apart. This is like it holds together. It's rubbery, just like those flukes that I was sharing with you. All right, so I'm going to go to this. So the video is going to start immediately, and then we'll talk about it after. This short video was sent to me by one of our students who was diagnosed with multiple sclerosis, and this is a large roundworm that she passed. She was taking parasite drugs to treat the parasites, and she was also doing oxidizing enemas. She would have done one oxidizing enema and then a following one approximately 24 hours later. And this roundworm was passed with the second oxidizing enema. And you can see how well it still holds together. This is definitely a roundworm, and it is not mucus. I have the most amazing students. Like, they're just so amazing. Next week, I'm going to do a case study of one of our students that I got her permission, and I'm going to share her journey. And like, she's just started treating, and I didn't get a chance to grab the successes from this week. The successes are absolutely amazing every week. So like, people are walking better, they can stand up taller, they're stronger, their spasticities they're doing things, they're doing things in their life, and this can happen so incredibly quickly. Of course, if we've been disabled for a very long period of time, sometimes it takes a little bit longer, it's a little slower, but that doesn't mean that we can't have a life-changing experience. We've seen that also. So the exciting thing is next week I'm going to do her case study, and I'm going to share with you, like, she's like, day 1, day 2, day 3, what she passed. Like, it's just shocking. And I'm doing this, number 1, to help you to see why you feel so lousy. And I'm not saying that you only have roundworms or that you even have roundworms, but if you have chronic disease, you have parasites. And roundworms are really common in people that have chronic disease, for sure. And they make you feel horrible. And for the research to be telling us that they're immune modulatory, they're good for you, it's like that is a decoy that is getting us away from the recovery that we want. And it's setting a lot of practitioners off on the wrong path, and they're not able to help us because their belief system is wrong. So I'm going to go to a couple of questions here. All right. Hello, Allison. Hi, Joanne. Constipation? Yes, they cause so much constipation. Some of our students, like the vast majority of our students, are severely constipated when they start, and they have been for years. A small number of them have diarrhea, and there can be different parasites that cause, but some of them will have alternating diarrhea and constipation. But yes, the parasites cause the constipation. So before we start treating, we want to encourage daily bowel movements. We're using some very safe natural supplements that can help to get the bowels moving, because we don't want to be treating these worms and having them decay inside of us. Remember, I told you when they start to die, we can start to notice a little bit of symptoms. They're also a heavy metal sink. The roundworms, the bigger, smaller parasites, they carry up to, I've heard, 200% more metals in them than we do. So it's wonderful that they're absorbing heavy metals in us. But then if we kill them and they start to break down and digest in them, then they're releasing the metals back into our body. So we want to be having daily bowel movements before we start to treat them. And the constipation, Joanne, resolves when you have treated these horrible worms. Absolutely. And it's not just the roundworms that cause constipation. Hello, KF. Hi, Maggie. You're very welcome. Yes, I'm so excited. I'm hoping to connect with Dr. Lee Merritt. She's doing a lot on parasites too, which is so exciting. It's starting. Finally, it's starting. Yay. So glad to be here. Hi, Kiki. Hello from Mexico. Hi, Debbie. You're so very welcome. You guys have any questions? Michael, I wonder if you have an opinion on uh, Cambo medicine. I don't know what that is. Honestly, I will look into it, but I don't know what that is. Hi, Kylie. You're very welcome. I know you guys are very, very grateful for this. Whoa, hello. My pleasure to share all of this with you. Holistic doctors in our area, they're also starting to do the oxidizing agent orally along with ozone therapy and hydrotherapies. That's wonderful. So this whole topic of the oxidizing agent, the reason I have to say this, it's been so heavily censored for years. It's been just absolutely horrible. And so since this last thing that we've gone through, this virus that we've been dealing with, there are multiple countries that had to use this oxidizing agent to help their citizens to recover from that virus. And since then, there is now a continuing education group. So there's thousands of scientists and doctors around the world that are starting to use it. So it can't be censored anymore. But I mean, still, the big platforms can censor it. That's why I'm very sensitive to not using those words on here. Is there ever a patient that through treatment doesn't help? No. And what would be the next step? So multiple sclerosis is an infectious disease. And is it that we all have identical parasites? No. If it was, I could literally write a book and we could cure the world. And I wish we could, but it's not that easy. There are very similar parasites in not just MS, but we've seen in PLS and in other neurological diseases also, but there are also differences. So if I don't know, Debbie, if you have followed my work, but number one, like any microbe that lives in you and causes you harm is a parasite in my books. So that would be different types of bacteria that can cause you harm. It could also be protists, which are single-celled parasites. Their physiology is a little more complex than bacteria. Things like malaria and babesia would be protists, and giardia also. And then there are different types of fungi. So there's molds and there's yeasts that are parasites. So they live in us and they cause us harm. And then there's worms, and we talked about the big ones today. But remember, there are roundworms and there are flatworms. So our students, they do have a lot of, very often, intestinal flukes. They can have liver flukes. They can have tapeworms. Especially if you're new to this, Dr. Alan McDonald found tapeworm larval cysts. So the immature form of the tapeworm gets into the central nervous system and forms little sacs. And Dr. Alan McDonald found that in 10 out of 10 MS subjects that he looked at. He also found small filarial worms in the central nervous system. One of my students this week shared some work by Dr. Alan McDonald. Like, he's been studying Borrelia. For sure, it's present in MS. That's the bacteria that causes Lyme disease. And then also in Alzheimer's, he's been studying that for many, many years, finding that there's a lot of Borrelia in the plaque of Alzheimer's patients, but he's also found nematodes in the brain of Alzheimer's patients. So it doesn't matter what neurological disease we're dealing with. It's just we're out of balance. We have too many disease-causing parasites and not enough health-promoting microbes. And so we have to treat them. The way that we do this is through the Live Disease-Free plan. It's something that we've perfected over 10 years in working with large groups of students. So we've served hundreds and hundreds of students in over 15 countries, not just multiple sclerosis, but other diseases. And we found that if you skip the diet part, the drugs just don't work very good. So following the Live Disease-Free diet, getting the carbs low, and I learned that through many other wonderful hero doctors, they have been, finding that low carb is really good for cancer, and it's really good for people that have autism, and it's really good for diabetes. Like, people can come off their diabetes medications with their doctor by going low carb. It's really good for epilepsy, and that most common cause of epilepsy is parasite in the brain. So going low carb is truly really helpful so that we're feeling better before we start treating. And then we support the body. We just go through a checklist for healing. And then again, we are going to get energy tested. So we're feeling a lot better before we start treating. And then we get energy tested. And then we use the treatments that work the best for us. And we have to use the effective doses. And our students usually test well for 3 to 5 parasite drugs at one time. We don't start with all of them like that, but they're introducing them slowly, one at a time, and in a systematic, strategic manner. So sometimes it could be 2. When you take them together, they're tolerated really well. There's a synergistic effect, so there's a better killing effect. We're also using the oxidizing agent, either and orally and enemas, and we use herbs. So we're using a layering of therapies for treatment, and that's where the magic is really happening. That's why we see all these amazing pictures, because just using the parasite drugs, so my students that are more disabled, that are not able to do the enemas, their recovery is a little slower. But what we have found also with them is that as they're feeling better and better, some of them have come out of wheelchairs and they're starting to, walk, holding on to things, holding on to the wall. And then as they're feeling better, then they can start to do enemas too. So we're using safe and somewhat effective doses of the parasite drugs, but again, I wish that this was just mainstream, and it will become mainstream the more we talk about it, right? The more that doctors become aware. I know with this last couple of years, there have been a lot of doctors that were very, very upset that they were not really permitted to, in different countries, permitted to treat their patients. They were told, no, 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 wait for the vaccine, wait, wait, wait. And a lot of people suffered terribly, and some possibly died that did not get early treatment. And so there's a lot of doctors that are like, how can you tell me how to run my practice when I'm a doctor and I'm experienced? These are safe things that I want to help. So once they really understand that we're dealing with parasites, I can guarantee you that there are a lot of doctors that are going to be like helping tremendously. Some countries will be harder than others. So Canada is really tough. Australia, New Zealand is really tough also. It's almost illegal to treat parasites in these countries. It's ridiculous. And so this is where, creating a lot of awareness. Number one, getting well ourselves. We're not going to wait for the system to change, but to get well ourselves and then to help bring change is really the answer for the future. So, Debbie, if this makes sense to you, like what I would do is if you're new to all of this, then just look at some of my videos. I've got a ton of videos on YouTube and Facebook. The most recent ones would be on our blog posts. So on livediseasefree.com, you can see our blog, and there are some really important topics there. You can see my notes. You can watch the videos. They're a little bit more shorter there. They're edited. And you can look at different topics. You can see different pictures. There's links to if you want to do some more digging. And then when you're at the point, like if you need support, if you're like, I'm having a really hard time finding the right support, then reach out to us. Watch my masterclass training. In there, you'll see the steps we take in a lot more detail. And you'll understand, number one, the steps you got to take. And if you need support, we can support you in the Live Disease Free plan. We have lots of students that we're working with right now. And again, I'm really excited for next week because that's going to be an amazing case study. Please invite people to come and join for next week. I promise you that it'll really get them excited. All right, a couple more questions here, and then I'm going to let you guys go. And hi, Natalia. Shirley, my neurologist couldn't be bothered. Yes, I personally would not worry too much about trying to convince a neurologist. A neurologist is a pharmaceutical expert. Like they're an expert on the MS medications. That is their expertise. And so that's what they have been trained in for so long. Unless it's a neurologist that is studying the microbiome in MS and they're really interested in the types, could there be differences? That's a very rare neurologist. But if you find someone like that, they might be interested. But for the typical neurologist, I would not try to convince them. It can be a very negative experience. You could just say, hey, I just wanted to share some research with you from Dr. Alan McDonald, who's a pathologist. He found roundworms, and he found immature tapeworm larvae in the central nervous system of MS patients, and just see what your doctor says. He says, oh, well, whatever, I don't know. Like, if he's negative, then just let it go. But if he's positive, then forward that to his email and let him take a look at it. You're not going to convince anyone, but you're planting seeds, and that's always the first start. And then also when we get well, it's like, okay, well, if you get well, then maybe it's just a fluke, right? But then their next patient gets well, and then their next patient gets well. And then after a while, 10 people get well, and then they're starting to scratch their heads, and they're starting to hear more and more about it. Patients coming in like, have you heard about parasites and multiple sclerosis? So there will be a snowball effect eventually, but like, just don't try to force the issue, because it'll just make you feel sad, because sometimes it can be quite negative. Susan, someone who has MS, please share this with them. Please, that's what you guys can do. I'm the one who's here every week sharing all this research, connecting all the dots, and you can help by spreading the word. That is the big thing. So share, like, and subscribe. Maggie, you were recently diagnosed with multiple sclerosis and had your first neuro appointment last week. She just looked at you and like you had 3 heads when you asked her about parasites. Yes, exactly what I thought. So I really wouldn't worry too much about that, because the thing is that if we really had a healthcare system, and when they don't know what causes MS and they don't have a cure, in my opinion, my humble opinion, it is their responsibility to check to make sure that they're not missing something. And if there's research that potentially shows a link between MS and parasites, and they're just poo-pooing it without looking at it, that's not good, because they're in a position where they have a lot of responsibility. And I take my work with a lot of responsibility. I know that I don't know everything, and I'm always researching. So that is the only way. We have to stay humble, and we have to stay open. That is the key. So you started a few years ago working with functional medicine doctor and gave you such hope. You've been living clean and feeling better than ever because of what I've shared. I'm so happy for you. That is so amazing, Stacy. And Nikki, same. Okay, I got that one. Oh, yeah, Maggie, you said that your neuro also told you that changing your diet, going keto, was not going to touch the MS. It was good overall for health, but it won't affect the MS. Well, that's what his opinion is, but what is his opinion, his or her opinion? What is that based on, right? And the whole point is that with the live disease-free diet, it's not something like, oh my gosh, it's something I've invented and I want credit for it. No, it's like we had to give it a name, because paleo was still too high carb, keto has dairy, so the live disease-free diet is kind of in the middle. It is the sweet spot of getting the carbs low enough, but if you have dairy product other than butter, it will make the parasites more active, and so that's why we call it the live disease-free diet. And because we've worked with so many students and we really know what aggravates and activates the parasites, we have a very good sense. We've had in the past few months, like I would say maybe since like the end of last year and just the beginning of this year, we have had 4 students that had double vision from the MS, and just with diet alone, their eyes totally went back normal, and other symptom improvements too, but that is something that's quite new. We see osteoporosis totally, like people that have been on medication for osteoporosis for years, and then all of a sudden they have marked improvement in their bone density. They're off their osteoporosis medication. We have women that are treating MS by treating the parasites, and they get their fertile again, and then they can actually get pregnant. So it is not just about MS, it is about just decreasing all the stresses that the parasites are causing so much inflammation, stress in your body, and decreasing that. And then, of course, using a holistic approach. And then your body just starts to work the way that it's supposed to work in every single aspect. And you look younger and you feel younger, which is amazing. So, last question here. Doctors in the US aren't helpful at all. That's the truth, surely, for most countries. You just want to treat the symptoms. They just want to treat symptoms with med. Where do you go with only Medicare? Like, was in a similar boat, Shirley. I live in Canada, and we have a healthcare system that's covered. And if I would have followed that system, I would have had to use the MS drugs, work with neurologists, and I don't even know if I would have been alive today. That was 35 years later. So I decided, no, I'm going to take a different path. And it did cost money. It cost money out of my pocket. Luckily, I didn't do the CCSVI. I didn't do stem cells. So I didn't spend $100,000 to $300,000 on my health. But I still did spend thousands of dollars because it was trial and error. And I did not have a plan. I did not have a coach. Nowadays, like in the Live Disease Free plan, we help students to get ready to treat and treat as quickly as possible. There's so many supplements you don't need. There's so many tests that are not going to make a difference. The sooner you get ready to test by just doing very basic things to support the body and get ready to treat and start treating, you can really decrease the costs. And even things like the oxidizing agent that we recommend, like we really like ozone, but it's expensive. And the oxidizing agent is cheap. So you don't have to spend thousands of dollars to get well, like, 20, 30, 50, $100,000. It does cost a little bit, but what is your life worth, right? And if you just wait with Medicare, you'll be very sadly disappointed because, change your diet. That doesn't cost anything other than you're going to buy a few more vegetables, low carb vegetables, eating healthier, change your diet, support your body. I've got videos on that. But if you want your health and your life back, you've got to treat the parasites, and you do need support while you treat. And we can help you if you are having a hard time finding the right support. So with that, I'm going to let you guys go. And again, next week, I will be sharing a case study of a wellness champion, one of our students who is recovering from multiple sclerosis as we speak. I'm going to share with you like her journey, like from when she started, just to summarize it. But just this last week, like I got like 7 or 8 pictures of every day when she did the enemas, like what she's passing and how she's feeling, right? And I apologize for not sharing the symptom improvements. Next week, that will come with hers. I'll share some of the other ones because it was like, we just have our calls on Tuesdays, and it's just, man, if the doctors heard the symptom improvements in my students every week, they would be so excited. They would be like, this is not possible. And this is what I really hope that we can help to bring change. So with that, keep up the amazing work. And if you need support, watch my masterclass training. Otherwise, start to learn, watch our videos. LiveDiseaseFree.com is probably your best bet to see the written notes and the videos, or Rumble, Facebook, or YouTube videos. Take care and bye-bye for now.